Good morning, everybody. Welcome to Mount Sinai, South Nassau's Robotic Surgery Showcase. Behind us, you will be introduced shortly to our team of physicians and PAs and surgical teams who work every day using minimally invasive robotic surgical technology to treat a range of conditions from urologic, chest, colorectal, gynecological, and head and neck conditions. After we do a brief presentation and talk about the advantages of robotic surgery, we're going to invite everyone to come and do a live demo of the equipment behind us. Shortly, I'll be introducing Dr. Rajiv Datta, Chair of the Department of Surgery at Mount Sinai, South Nassau. I'd just like to talk a minute about the operating rooms that will be housing this equipment. So later on this year, Mount Sinai, South Nassau will open the File Family Pavilion. In that pavilion is the Fennessy Family Emergency Department, a biplane for stroke, and the new OR surgical suites, which will be instrumental in the expansion of the hospital's minimally invasive robotic surgery program, which is why we're here today. So I'd like to now introduce one of the pioneers of robotic surgery here at Mount Sinai, South Nassau, and on Long Island, Dr. Rajiv Datta, Chair of the Department of Surgery.
Welcome everybody to Mount Sinai, South Nassau. Today we are here to talk about the latest technology which we are using in all kinds of surgery. Just a little background, 3 decades ago we all operated with big incisions, and the problem was the patients had a lot of pain, difficult operative procedures. Then came laparoscopy, and the robotics actually came in 2001. That was the first robot which was FDA approved. And what is the advantage of robot surgery to the patients? One is better visualization of the organs. It's a 3-dimensional view, which gives a very good, clear view of the organs. The second is extremely small incisions. They're tiny holes through which you can do major operative surgery. The third is that these robots at the end have a wrist, which is what they mimic what a hand can do. So they have a complete wrist movement, so you can actually operate around the tumors in tight spaces. And then lastly, the new robot, which is behind me, also has a tactile feedback, which means that just the way you would hold a tissue, you know how much strength to use. That is what the robot does. So for a patient, if they undergo major surgery, let's say for cancer, the advantage is that the recovery time, instead of days, can be just 1 day. Second is that they can get onto additional treatment without having to wait for things to heal. And third is they can get back to life. So what is a robot? Technically, it's a tool which is utilized by surgeons. With surgery, almost every specialty now is using the robot surgery. Behind me is a panel of specialists which we have at Mount Sinai, South Nassau, and each one is adept at using this. Starting from here, we have our PA and the support staff. Dr. Andaz, he's the director of thoracic surgery. He's done a lot of robotic cases here, including lung, thymus, esophagus. Dr. Stefanova, she's a bariatric surgeon, uses a robot for bariatric surgery and, of course, general surgery. Dr. Melamed, who's the director of thoracic oncology, he has pioneered the utilization of the robot not only for thoracic surgery, but also for bronchoscopy. Dr. Dean Pappas, who's the director of colorectal surgery. Rectal surgery is very complex and very difficult, which he navigates extremely well with the robot. Dr. Michael Herman, who's the director of urologic oncology. Actually, robots were first utilized for prostate, so his department, where he got trained decades ago, was one of the pioneers to use robot for prostates. Dr. Ann Buell, she's the director of GYN oncology. She's one of the heaviest users of robot to give great outcomes for our patients. And then we have the support staff. Thank you.
Good afternoon, everyone. Thanks for coming. So we're proud today to showcase our technology here at Mount Sinai, South Nassau. We have 3 robotic systems that we use on a daily basis. We're doing more robotic surgery in this institution than in any other facility on Long Island, I could tell you that. Essentially, what is all this? The misconception is that when one hears robotic surgery, they think that a robot is actually doing the surgery, that it's somewhat automated. That is not the case. At every step of the way, the surgeon is in control of the instruments. what the robotic system allows us to do is to basically have better dexterity. And as Dr. Datta was saying, we can work very delicately in close quarters and protect various structures. We see we see less blood loss, less pain. So the benefits of robotic surgery, and we'll get into it later in our demonstration, is clearly very significant. But essentially, if this, for example, is the patient's abdomen, we first place these ports that allow us to get inside of the abdominal cavity through which the robotic instruments are placed. Once the instruments are placed, then the actual robot is attached to the instruments, and now we have the ability to perform our surgery. The surgeon will then sit at the console right behind me, and while we're at the console, we're able to manipulate the four arms of the robotic system. And again, the robot has wrists, and that allows us to be very specific in what we're doing and to essentially improve outcomes.
Yeah, so Dr. Papa is going to sit down, and at the bedside, we just saw our support staff, the PAs and the nurses who are at the bedside. And this is just for demonstration. The patient doesn't have so many holes, okay? It's just for demonstration, just has one hole which goes into this thing. And the other advantage for the surgeon is that it's ergonomic chair, so they can operate for longer hours without getting tired, so the patients can have better outcomes. So as you can see, Dr. Pappas has already sat down, and in fact, the way he communicates to the team is through a microphone which the team can hear. So he's not in isolation. That's important to know. And whatever he does is usually there is a monitor where it gets displayed, and so it's not only verbal communication between the team, but also visual with a three-dimensional monitor. And they can draw on the monitor of what they are operating, what needs to be done. So that's the other advantage, that the communication between the teams is extremely clear. And as you can see, he's operating there, and the arms are moving here, and they are inside the abdomen if you want to take a view from this side.
Yeah, so again, the dexterity that we have when we're using this type of system is just incredible. Would be very difficult to do laparoscopically, and just the fact that we can, pick up various structures and, just even, manipulate them in our hands. And in addition, we have control over the camera, and that's something that, you don't require assistance in order to help you see what you need to see. The surgeon, using these various foot pedals, can move the cameras around, and therefore I'm not dependent on anyone else to show me what I need to see, which is one of the issues with laparoscopy. So what we're able to do here is just, this type of dexterity is just incredible.
This is our robotic bronchoscopy system right here, as you can see. It's a new device that was developed in the last few years that allows us to biopsy peripheral lung nodules. And there's a lot of benefits to this system. Patients are asleep. The device goes through their airway into the lung, so there's no pain involved whatsoever. Previously, patients would require what is called transthoracic biopsies, where you'd stick a needle through the chest, which is very uncomfortable for most patients. Also, a lot of times patients have nodules or lesions on both sides of the lung that you couldn't biopsy through one event. With this device, we're allowed to use one anesthesia event to biopsy any lesion in the lung. In addition, when it comes to lung cancer, which is what about 75% of the nodules are that we diagnose, we're able to, at the same time, do mediastinal staging, where we use an additional device while they're still asleep in the same anesthesia event to biopsy nodules within the chest and fully stage the patients and determine their treatment plan afterwards. And the real benefit to this device is that in the future, it's going to be a catheter delivery system where the catheter takes us to the tumor and we're able to bring a probe in, freeze the tumor, burn the tumor, give local chemotherapy. Although we're not at that point yet, that's the future, and that's where this device is going to take us. As you can see here on the left, there's a digital image that was planned beforehand from a CT chest, a basic study that the patients get. And then on the right is the live view. So as you can see here, what I do is follow the view. Every time I get to a bifurcation where there's two different airways, I check to make sure everything looks the same, and then I keep going forward. I'm at another bifurcation, I check. I know I have to go down here. But another bifurcation, I just check, go down here. And as I keep going and following the path to the left, as everything lines up, I eventually get to the nodule. Then I confirm the location of the nodule with ultrasound once again, and I'm able to biopsy it in many different ways. Oh, this is the model right here. So this is mimicking a lung. And as you can see, it's pretty accurate, and what the view I had just now is very similar to what I have in the operating room as well. So I think later on people feel free to come up and play with this and see how easy it is. Actually, I think, if I'm not mistaken, the company employed gamers in order to develop the most ergonomic system, and they really did. It's really a simple system to use that's very, very effective. So we're very proud to have this at Mount Sinai, South Nassau, and we're very excited to offer it to the local populace here.
So overall, it has been really good. In fact, patients, as you know, are very knowledgeable. Before coming to doctor like me, Dr. Datta, they go to Dr. Google first. And what does Dr. Google say? Robotic surgery. So they come looking for robotic surgery in every organ. In fact, there are a couple of times the patient will come in with a lesion right on the skin. They want to know, will we use a robot? So we have to tell them it's for inside, not for the outside. So in today's world, the patient population is the most well-read, and nobody walks into the office without reading. And everybody wants to know, after all the discussion is done, can this be done robotically? So it's also a combination of we trying to do the right things and patients also driving us to make sure that we are doing state-of-the-art operative procedures. Thank you. Yes, it will happen. As you briefly saw what Dr. Melamed was showing, right? That's kind of an AI where a CAT scan, and they're combining the CAT scan into the real model. Even though at this point, Dr. Melamed is in complete control. Nothing happens without him doing anything. He's not AI, he's real. But in the future, you know, the AI will be utilized definitely. There is a future. I mean, the platforms are being developed rapidly, whether it's for diagnostic in radiology, pathology, whether it's in surgery, but it's not there for prime time, but you know, keep tuned. Thank you. Thank you, everybody.